Welcome to Thriving Module 2. In the last module, we discussed why a toolkit that addresses the needs of people with IDD who have experienced trauma is important. In this module, you will learn about typical milestones that occur throughout a person's development and how IDD and traumatic experiences can disrupt those milestones. After completing today's training, you should be able to do the following. Define IDD and various types of disabilities. Discuss developmental tasks across typical development. Describe how IDD and traumatic experiences may disrupt typical development. And identify the areas in which a person's functioning is affected by IDD and subsequent adaptations that must be made. So what is development? Development is defined as the process of change by which people become able to handle even more complex levels of moving, thinking, feeling, and relating to others. Development is more than just about physiology or biology. It is also about who you are as a whole person. For the purpose of this training, we're going to focus on 5 specific domains of development: language, motor, cognitive, social and emotional, and adaptive skills. And development is not just for children. We all continue to develop throughout our lifetime. As a provider, being aware of these areas of development helps us to consider how we might support the person develop to his or her full potential in all areas of development. We'll consider each of these areas of development and then discuss how IDD and trauma might interact with development. The first is language development. It includes expressive language, which is how well a person communicates using sounds, gestures, or words. Receptive language, which is how well a person recognizes sounds and how much they understand spoken words and directions. And pragmatic communication, which includes nonverbal and social communication. Motor development refers to how the body increases skills and performance. Gross motor development is how well a person can move his or her body, the development of our large muscle groups, such as walking, running, and skipping. Fine motor development is how well a person can use his or her hands and fingers to make things happen. The development of precise use of our muscles. It is involved in tasks such as tying shoes, fastening buttons, and using zippers. Cognitive development is learning the skills of understanding, memory, concentration, along with learning to communicate with family, friends, and community. In the early years, cognitive development is focused on orienting attention and basic problem solving. Around school age, cognitive development focuses on functions related to neurodevelopment and intelligence. This can include attention, memory, spatial ordering, sequential ordering, problem solving, and social thinking. Social and emotional development is the development of a person's identity, self-image, relationships, behavior patterns, accompanied with learning the skills to live in a society as a member of the community. Social and emotional development includes behavioral development. Sensory development is included in social and emotional development, and sensory preferences and sensitivities remain important throughout the lifespan. The ability to regulate feelings and behavior, emotion regulation, is a central part of social and emotional development. Adaptive functioning is the ability to adapt to various demands of normal daily living. It includes areas such as self-care, activities such as eating, toileting, and bathing, community, including leisure activities, interest in activities outside the home, relationships with others, and meaningful relationships with other people with and without disabilities. Home living, helping adults with household tasks and taking care of personal possessions. Health and safety, the knowledge of basic health activities and physical dangers. All of the other areas of development that we discussed, such as motor skills, social communication, and self-regulation skills, feed directly into adaptive functioning and influence the extent to which a person is able to independently get along in the world and what sorts of support they need to live as independently as possible. Knowing the federal definition of IDD is important because it impacts the available services for people with IDD and families. Clinicians and families need to know how to navigate the system. The definition emphasizes functional limitations in adaptive behavior, which manifests before age of 22. or understanding of the impact of disability on functioning. Reviewing areas of functional limitation suggests areas for accommodation and/or skill building. There are many different types of disability. Although this toolkit will not cover every different type of disability, we will review different types for the purpose of recognizing that there is a range of issues that people with IDD face. Additionally, there are different assessment strategies and strategies for accommodation and/or skill building associated with different types of IDD. These include genetic, neuromotor, mental health, neurological, intellectual, and sensory. It is helpful to use a biopsychosocial model when thinking about the categorization of disabilities. Biological, psychological, and social factors all play a significant role in human functioning in the context of disabilities. Disabilities are best understood as a combination of biological, psychological, and social factors, rather than purely in biological terms. So we recognize that these categorizations that we are offering here are somewhat false, as most disabilities don't cleanly fit into just one category. However, for the purpose of this training, it gives us a place to start with thinking about different types of disabilities. Let's briefly take a deeper look at each of these domains of disability. A genetic disability is a disability caused by an absent or defective gene or chromosomal aberration. Examples include Down syndrome. Down syndrome, or trisomy 21, is caused by having 3 copies of the 21st chromosome instead of the usual 2 copies. It is a common cause of intellectual disability in people. Co-occurring medical symptoms, such as congenital heart defects, respiratory and hearing problems, and a variety of mental health issues, including anxiety and ADHD, may be seen. Fragile X syndrome is another common inherited cause of ID in people. Many people with Fragile X also have autism. It is caused by a mutation on the X chromosome. Boys who have only one X chromosome are usually more affected than girls. Prader-Willi syndrome is a non-inherited genetic disorder, usually characterized by mild ID, overeating and obesity, and obsessive-compulsive behavior. Angelman syndrome is a genetically based developmental disorder characterized by ID, speech impairment, happy demeanor, and unusual motor behavior. Williams syndrome is a genetic disorder usually characterized by low intellectual functioning, unusual strengths in spoken language and sociability, hyperactivity, impulsivity, and inattention. And phenylketonuria, or PKU, is an inherited metabolic disorder that can cause severe ID if the metabolic problem is not addressed adequately through a very restrictive diet. Note that not all genetic disabilities are inherited from a parent. For example, Down syndrome is a non-inherited disability, which is caused by an error in how the chromosomes segregate, causing a person to inherit an extra 21st chromosome. A neuromotor disability is a disability caused by damage to the central nervous system, the brain, and the spinal cord. The resulting neurological impairment limits muscular control and movement. Examples include cerebral palsy, the condition marked by impaired muscle coordination, called spastic paralysis, and/or other disabilities, typically caused by damage to the brain before or at birth. People with cerebral palsy may have typical intellectual functioning, though some have learning difficulties to varying degrees. They are also at risk for seizures and co-occurring mental health concerns. Spina bifida is a congenital defect of the spine in which part of the spinal cord and the membrane that encloses it are exposed through a gap in the backbone. It often causes paralysis of the lower limbs and sometimes intellectual disability or learning disability. Traumatic brain injury is a non-degenerative, non-congenital insult to the brain from an external mechanical force, possibly leading to permanent or temporary impairment of cognitive, physical, and psychosocial functions, and is associated with diminished or altered states of consciousness. A mental health disability is a disability caused by a mental health condition with a severe impact on functioning, and may include severe depression, anxiety disorders such as obsessive-compulsive disorder, panic disorder, generalized anxiety disorder, or social anxiety, bipolar disorder, sometimes called manic depression, and schizophrenia, among others. It is important to note that more and more research supports that many conditions that traditionally have been thought of as mental health diagnoses have a neurological basis, and demonstrates the challenge of labeling conditions as categorically mental health disorders. We will discuss neurological disabilities such as autism and ADHD in greater detail on the next slide. It's also important to understand how diagnostic labels can be helpful or harmful. Diagnoses can be helpful for the purpose of establishing service eligibility, a treatment strategy, or insurance reimbursement. However, diagnoses can also be harmful when they are used to exclude individuals from receiving services or to merely label an individual as opposed to considering the manner in which it describes how an individual interacts with the world. Neurological disabilities. This domain is quite broad and includes neurological and medical conditions. However, we are not saying that every person with a medical issue has a disability. For example, many people have epilepsy that is controlled with medication and does not impact their functioning or ability to participate in most, if not all, activities as their peers. For some people, though, medical conditions have a severe impact in limiting functioning and are thus considered a disability. Some examples include autism and ADHD. Autism is not a mental health condition, although autism spectrum disorder is a diagnosis in the DSM-5. It is a disability. People with autism don't recover. We teach them how to manage the world they live in. Additionally, autism is often characterized by ID, sensory conditions, language deficits, and inappropriate social behaviors. Again, it is important to note how diagnostic labels can be helpful and harmful, as we discussed on the last slide. ADHD is increasingly recognized as a condition that is due to neurodevelopment immaturity, and as a developmental delay, a neurological condition. However, it is still considered a mental health diagnosis and is reimbursed as such. Fetal alcohol syndrome is caused by maternal alcohol consumption during pregnancy. FAS is characterized by ID, hyperactivity, slow physical growth, and sometimes craniofacial anomalies. Lead poisoning occurs when lead builds up in the body, often over a period of months or years. Even small amounts of lead can have serious health problems. People under the age of 6 are especially vulnerable to lead poisoning, which can severely affect mental and physical development. Epilepsy is a neurological condition in which a person has repeated seizures over time. Seizures are episodes of disturbed brain activity that can cause changes in attention or behavior. Intellectual disability includes significant limitations in both intellectual functioning and adaptive behavior, which covers many everyday social and practical skills. This disability originates before the age of 18. Intellectual functioning refers to general mental capacity, such as learning, reasoning, problem solving, and so on. One way to measure intellectual functioning is an IQ test. Generally, an IQ test score of around 70 or below indicates a limitation in intellectual functioning. In some cases, an IQ score up to 75 might also indicate a limitation if an individual has significant challenges in his or her adaptive functioning. Adaptive functioning is the collection of conceptual, social, and practical skills that are learned and performed by people in their everyday lives. A sensory disability is a disability that involves any of the 5 senses. It can also impact kinetics, the awareness of one's body and space. It generally refers to a disability related to hearing, vision, touch, smell, and/or taste. Sensory integration issues result from the brain's inability to integrate certain information received from the body's 5 basic sensory systems. Those who have sensory integration challenges may be unable to respond to certain sensory information by planning and organizing what needs to be done in an appropriate and automatic manner. The following are some signs of sensory integration problems: oversensitivity to touch, movement, sights, or sounds, underreactivity to touch, movement, sights, or sounds, a tendency to be easily distracted, social and/or emotional problems, activity level that is unusually high or unusually low, physical clumsiness or apparent carelessness, impulsive, lacking in self-control, difficulty in making transitions from one situation to another, inability to unwind or calm oneself, poor self-concept, delays in speech, language, and motor skills, and delays in academic achievement. Vision impairment or blindness, and hearing impairment or deafness are also examples of sensory disabilities. It's important to consider the experience of living with IDD, not just having IDD, both from the person's and family's perspective. This raises the question, what is the adaptive functioning of the person with IDD? Disabilities can impact functioning in a number of domains, as shown on the slide. What we want you to do is think about how living with IDD affects the quality of life for the person and the family. Imagine people with various disabilities. What are some of the ways their daily functioning is impacted in these areas? Think about the challenges that come with each of these areas and start to think about how you, as a provider, can help support people with IDD. For instance, living with IDD may inhibit the way people can ask for help. Quality of life is extremely important to people with IDD and their families. As a provider, you always need to keep in mind how you can support or increase the quality of life for your clients. You'll need to consider how each of these domains of functioning may be impacted by a traumatic experience. As a provider, you will be or are planning trauma-informed support services and treatment. So we have to take into account all of these areas of functioning when you draw up service plans for your clients. We'll be discussing this more in Module 5.